Surgery for another edition of Thursday Thoughts. Today's going to be pretty quick. We have an event going on here at the office for Abelli, which is our cellulite treatment, minimally invasive that we do here. But today we're going to be talking about the importance of mental wellness during the post-operative period of your recovery. So we've talked about this a little bit before, but it's a super important component of the recovery process because you're going to face a few different challenges during your recovery phase. And this is really has to do with the different stages we go through during the post-operative phase. So leading up to your surgery, you're really excited, it's something you've been thinking about for a long time, and you're finally making the leap to, do something for yourself and make some improvements. And immediately post-op or the day of surgery, you're pretty hyped up and you do well with that. But then you're going to be dealing with post-operative pain for the first few days. And this is a little variable from procedure to procedure, and it can be more tolerated or less tolerated from one individual to another. But that's one challenge. And so going in there with the right mindset, knowing you're going to have some post-operative pain, and just being mentally prepared for that really makes that part a little bit easier to tolerate. Then the most challenging part, I think, of the recovery process that all patients go through is the kind of lull period in between that acute 1 or 2 weeks post-op and your final recovery months down the line. And this is the point where a lot of patients get a little melancholy because they're expecting these huge changes and they may not see them immediately because we're dealing with the recovery process, and this can take weeks or months for it to, truly show your final results. And so you just had a tummy tuck or a mommy makeover, and you're walking around hunched over and everything's still swollen. You need to just have the mental clarity that things are going to continue to improve and you're not going to really see your final result for weeks and months down the road, even though you'll see some immediate results. Be happy about that. It just may not be what you expect immediately. But then patients come around to this more euphoric phase of the recovery process after they've gone through that little melancholy dip where they're super happy with their results and excited for the future. And it really gives you a reason to get motivated to get different parts of your life in order. And some patients really find time to, make it to the gym and do other things to focus on themselves and their health a little bit more after undergoing some of these surgeries. So, it's kind of short and sweet, but if anybody has any questions related to that or plastic surgery in general, I'd love to answer them. All right, no questions today. Everybody, please go to pureplasticsurgery.com to schedule a consultation, and I look forward to meeting you soon, and I will see you next week for another edition of Thursday Thoughts.
Wait.
Oh, one question.
Thoughts on chin liposuction for people who truly carry a lot of extra fat across the neck?
Yeah, I think it is a great option for patients. So we're talking about submental liposuction, or if you do not have a nice sharp angle between your chin and your neck, it can be a great option for you. There's a few anatomic considerations we have to keep in mind when counseling a patient about this. One is the position of that fat. So we all have a muscle underneath that goes along our whole neck called the platysma. And if the fat is above that or between the skin and the muscle, we can go after that with liposuction. If it's deep to the platysma muscle, we cannot do that with just straight liposuction. That needs to be addressed with a more formal neck lift. And there's exams we can do in the clinic to see if you're a good candidate for that. But most patients are a candidate if they have a lot of fullness. And really, to get the best result, it should be combined with face tight or one of the other skin tightening modalities to help contour the skin around that area that's been liposuctioned.
How old is too old for surgery?
There's no set upper limit on that. We do have some restrictions in our office about doing office-based procedures or in our office-based surgery center just for patient safety, and that's around 60 to 65 years old at the high end. But there's a lot of people that are getting cosmetic surgery well beyond that.
Should I be scared I'm getting eyelid surgery?
No, I don't think you should be scared. Eyelid surgery is very well tolerated, and one of the procedures, especially if it's upper eyelids, that is often done just under a local alone.
I've been told my neck would be lumpy years later, I guess.
After submental liposuction, that's not exactly true. If someone does a good thorough job and they do good fat equalization at the end of it, you should not have that, unless perhaps if you have major fluctuations with weight, assuming a lot of weight gain. After that, it's possible, but typically that's not the result we see. All right, everybody. Hope you have a great day. We'll see you next week.